Good morning, ladies and gentlemen. Let me try it again. Good morning, ladies and gentlemen. Please stand for the national anthem of Jamaica. Please be seated. Ms. Christine Stegling, Deputy Executive Director, Policy, Advocacy, Knowledge, UNAIDS, and Assistant Secretary General of the the United Nations. Dr. Harbas Barbosa, Director, the Pan American Health Organization, PAHO. Dr. Rhonda Seeley, Assistant Director, PAHO. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Jamaica. The Honorable Orlando Terrelong, Minister of State in the Ministry of Foreign Affairs and Foreign Trade. The Honorable Kevin Bernard, Minister of Health at Belize. Dr. Karen Webster Carr, Acting Chief Medical Officer of Jamaica. Members of the Diplomatic Corps. Dr. Monica Alonso, Chief of the HIV/AIDS Unit at PAHO. Mr. Ian Stein, WHO PAHO Country Representative for Jamaica, Bermuda, and the Cayman Islands. Dr. Olga Izaga, representative from the UNICEF Jamaica Country Office. Dr. Richard Amenia, UNAIDS Country Director. Mrs. Alethea John Douglas, MOH EMTCT Focal Point for St. Vincent and the Grenadines. Ms. Esther DeVille, MOH EMTCT Focal Point for Belize. Ms. Valerie Wilson, the representative from the Regional EMTCT Validation Committee for the Americas and the Global Advisory Validation Committee. Ms. Judy Ann Nugent, the Regional Advocate for Persons Living with HIV. Directors and staff of the Ministries of Health and Wellness, healthcare workers, distinguished guests, ladies and gentlemen, members of the media, all our esteemed colleagues here in the room at the Jamaica Pegasus Hotel in Kingston, Jamaica, and those joining us online, good morning. No, man, that sounds weak. Good morning. And in Jamaica, we say wagwan, right? We have to add that piece. And we say wagwan for two things, right, Minister? We say, when we're saying hello, what's happening, what's going on here? And when we see a crowd, we say, what we say? Wagwan, right? Because we want to know what is happening here. And we don't run from, Jamaicans don't run from the crowd. We run to the crowd because we want to see what is happening here, right? So something big is happening here this morning. This morning we are here to celebrate. We're at the Caribbean Certification Ceremony for the elimination of mother-to-child transmission of HIV and syphilis. Well, not clap for that. You should clap for that. We should clap for that. My name is Stephen Davidson. I'm the Director of Public Relations and Communications at the Ministry of Health and Wellness, Jamaica. And of course, we are here to celebrate a win for 3 countries. We are here to celebrate a win for Brazil, Belize, right? It's Belize, I should say. Belize. Dr. Barbosa should have been the one to cheer, right? It's Belize, St. Vincent and the Grenadines, and Jamaica. All right. Yes, it's close. The colors are close. Of course, today we are joining 17 countries and territories globally which have achieved this designation, and 11 of those 17 countries are in the Americas, right here. And because I have a Jamaican audience, I have to add this piece. Jamaica is the largest English-speaking Caribbean island to achieve this certification. And so we're going to begin our program with some opening remarks. And of course, with your consent, I'm sure our speakers are allowed to use an abbreviated version of the salutation. So I've already established the protocol, so you are allowed to give an abridged version of your salutation. We're going to take opening remarks from Ms. Judy Ann Nugent. She's the Regional Advocate for Persons Living with HIV, to be followed by Dr. Monica Alonso, the Chief of the HIV/AIDS Unit in PAHO, and then Dr. Olga Izaza, representative for the UNICEF office in Jamaica, and she is representing the regional director who is unable to be here. So let us begin with the opening remarks with Ms. Nugent. All right, not seeing her. We're going to go to Dr. Alonso, please. Please make her welcome Dr. Monica Alonso, the Chief for the HIV/AIDS Unit at PAHO.
Good morning. The Honorable Christopher Tufton, Minister of Health and Wellness of Jamaica, Honorable Orlando Tarlonge, Minister of Foreign Affairs of Jamaica, Honorable Kevin Bernard, Minister of Health and Wellness of Belize, representative of the Minister of Health and Wellness of St. Vincent and the Grenadines, Ms. Arlita John Douglas, Dr. Jadwas Batbosa, Director of the Pan American Health Organization, Dr. Rhonda Seeley Thomas, Assistant Director of the Pan American Health Organization, Ms. Christine Stegling, Deputy Executive Director of Policy, Advocacy, and Knowledge Brands of UNAIDS, and the representative of the Regional Director of Latin America and the Caribbean for UNICEF, Olga Izaza. Distinguished guests, esteemed ladies and gentlemen, during this joint moment of celebration and congratulating Belize, Jamaica, and St. Vincent and the Grenadines, I reflect on what it took to accomplish what we are here celebrating today. And I would highlight three elements: the generation of evidence, the political commitment, and the action of all people involved, including communities and civil society organizations. If we remember, 1994 was pivotal, with the study PACTG 076 that demonstrated that using antiretrovirals, we could reduce by 2/3 the mother-to-child transmission of HIV. From then to now, much more evidence has been generated. We have more powerful drugs, more tools, and all this enables us to fight this infection. All these tools and drugs are being implemented by these three countries. For syphilis, on the other hand, a centuries-old disease, the introduction of penicillin in 1943 was pivotal for treatment. And the more new point-of-care tests are being instrumental to scaling up access to screening. But data is showing us that syphilis is on the rise in many countries, and increased surveillance and evidence-based and context-specific responses are needed to ensure that gains are sustained. With regards to political commitment, the Caribbean has a history of leadership and success in public health mobilization. The region has been a pioneer in the elimination of diseases, measles, polio, and it was the first region to embrace the target of elimination of mother-to-child transmission of HIV and congenital syphilis as public health problems. And finally, the third element, the gigantic team effort of persons in the three countries, from policymakers to each and every nurse, doctor, lab technician, contact tracer, counselor, epidemiologist, civil society group, and community member. They made it happen with clear guidelines, the right processes, appropriate training, models of care based on primary health care, and the availability of commodities, not to mention their determination and their resilience. It is well understood that we need to maintain what has been done. And now we actually try to go even further with the Elimination Initiative that aims to integrate the elimination of more than 30 diseases and related conditions. The achievement today of these countries is considered a milestone in eliminating communicable diseases as public health problems. This is a prideful moment. I congratulate you. And the team at PAHO is honored and humbled to be part of your path. I encourage all of us to disseminate the success stories and lessons learned to support other countries in the path to eliminate transmissible diseases in the Americas. Thank you.
Thank you very much. And now we invite Ms. Olga Isaz, a representative from UNICEF, to give her remarks at this time. Please make her welcome.
Good morning, everyone. The protocol have been established and observed, but let me allow the possibility to recognize and acknowledge the presence of the Director of Pan American Health Organization, World Health Organization, Dr. Jarbas Barbosa, and other officials from PAHO and WHO, Minister of Health and Wellness for Jamaica, Honorable Christopher Stockton, and other officials in the ministry, Minister of Health and Wellness for Belize, Honorable Bernard Kevin, representing the Minister of Health, Wellness, and Environment for St. Vincent and the Grenadines, Honorable St. Clair Prince, Arlita John Douglas, National Family Planning Coordination in the ministry, Deputy Executive Director, UNAIDS, and Assistant Secretary General of the United Nations, Kristen Sliglin, Regional Advocate for Persons Living with HIV, Judy Ann Nuggets, Directors, invited guests and colleagues, ladies and gentlemen. It's a pleasure to be here today. I am honored to represent UNICEF Regional Director, Gary Cornell, and to extend apologies on his behalf. He would have loved to be here, but unfortunately, this was not possible today. Today is a historical day for all the people of Belize, Jamaica, and St. Vincent and the Grenadines. In a significant year, when we celebrate 35 years of the adoption of the Convention on the Right of the Child, the elimination of mother-to-child transmission of HIV and syphilis is a crucial step in guaranteeing children's right to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines for achieving this double elimination of vertical transmission for HIV and syphilis. Since the introduction of the regional strategy and plan of action for the EMTCT of HIV and congenital syphilis, and subsequently the framework for elimination of mother-to-child transmission of HIV, syphilis, hepatitis B, and Chagas, Latin American and the Caribbean has been the global pacesetter, with Cuba being the first country in the world to be certified. As of today, 11 countries and territories in the region have achieved certification for EMTCT of HIV. While this milestone achieved by the 3 countries revitalize the EMTCT agenda toward the 2030 targets, unfortunately, many children are being left behind in the progress to end AIDS. For instance, while many countries are striving to achieve the 95 targets, in 2022, only 39% of children between 0 to 14 years living with HIV in the LAC region receive antiretroviral therapy. Compared to this, about 70% for those who are 15 years and above. Within the Latin American and the Caribbean region, antiretroviral treatment for children and young adolescents falls below the global average of 57%, according to data from UNAIDS. We need to work harder to increase the coverage for diagnosis and treatment for all, and especially for children. One of the greatest benefits of EMTCT Plus programs is their contribution to improving the quality of integrated primary health care, particularly maternal, newborn, and child health services. There is an urgent need to improve health systems and create a solid and resilient foundation on which EMTCT Plus and indeed all public health programs can be implemented and achieve sustainable results. With this certification, Belize, Jamaica, St. Vincent, and the Grenadines join 8 other Caribbean countries and territories that have already achieved this milestone. You are now in a unique position to encourage and rally other governments to prioritize adequate and sustained investment in healthcare to improve quality primary healthcare services and make them sustainable. This success in our region is also a reflection of a strong government commitment, successful collaboration among international organizations, civil society organizations, and individuals. The contribution from the joint UN team on AIDS at regional and country levels and the regional EMTCT validation committee are testaments of how we can work together to achieve results collectively and ensure that no child starts life with HIV. Finally, I would like to acknowledge the role of the healthcare workers who have remained focused on this target over many years and through many challenges. Your drive to ensure that no more babies are born with HIV and syphilis is inspiring. Thank you for your hard work. Thank you also, Belize, Jamaica, and St. Vincent and the Grenadines for bringing us one step closer to the entire region free of HIV and syphilis transmission from mother to children. Congratulations.
Thank you very much. And we thank all our partners, UNICEF and PAHO. At this time, we're going to take a look at a video presentation, and it will tell us the story of the journey of the 3 countries. So I invite you to look at the monitors at this time.
So MTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system.
To think that we can stop the transmission of HIV from a mother to a child is a tremendous goal that we have achieved.
The main challenges that we learn in this process is the high burden of social determinants of health. So it's not easy for families going through having a family member with HIV.
As a Jamaican, it really gives me joy just that we're able to accomplish this. Just with our team that we have here at National Public Health Lab, it was really just a good thing seeing us going through the various steps and accomplishing this.
But I think what is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So
personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving.
Yes.
Collaboration. Yes.
It's important for me to have this syphilis and HIV test because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby and any complications can it can cause complications to the baby, and that's what I want to avoid.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission.
I was overwhelmed with joy and happiness. And we are proud and committed to continue the efforts.
I think the team in health is phenomenal. And I think all of these accomplishments were done as teams. And I really congratulate the primary health care and the public health system.
This achievement is a crucial step in guaranteeing children's rights to health. UNICEF extends its warmest congratulations to the governments of Belize, Jamaica, and St. Vincent and the Grenadines.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Well, I think the biggest achievement is really to get people to understand the importance of the issue and to get the stigma out of the way so that we could do other work.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today.
That's what we heard, all the right words: teamwork, collaboration, and that's what happens when we get the group work right, when everybody participates in the group work. So another hand, please, for our countries who are being celebrated today. At this time, we're going to take remarks from Ms. Christine Stegling. She is the Deputy Executive Director for Policy, Advocacy, and Knowledge at UNAIDS, and she's also the Assistant General Secretary of the United Nations. Please make her welcome.
Thank you very much. We are always struggling to say we stand on the protocol that was already observed, so I will try. Thank you for already establishing protocol. Let me also greet honorable ministers and senior government officials here, friends from PAHO and friends from the UN, and a special warm welcome to healthcare workers and civil society and members of the community. And I think this video just showed us how touching it is and how much work it took for many of them to make this happen. So warm welcome to all of you, and a warm welcome to development partners. Ladies and gentlemen, I'm extremely delighted to be here in beautiful Jamaica with our partners from PAHO, from WHO, and from UNICEF for this landmark celebration. It's especially delightful to me because I have never been to Jamaica. So what a wonderful occasion to come for the first time to this beautiful place. I want to congratulate Belize, Jamaica, and St. Vincent and the Grenadines on your validation of the elimination of mother-to-child transmission of HIV and the elimination of syphilis. Governments in the Caribbean, as we have heard, there are a number of governments who have achieved this, have clearly made a political choice, a choice that no child, not one child, will be born HIV positive or with syphilis under their watch. This commitment of Jamaica, of Belize, and St. Vincent and the Grenadines, and the other 16 countries already on this path, is a powerful political choice that we call on for other countries to follow. In 2015, Cuba was the first country in the whole world to achieve the elimination of mother-to-child transmission of HIV and syphilis. In the 9 years since then, 18 other countries in Eastern Europe, in Southeast Asia, and the Caribbean have joined Cuba in this remarkable achievement. What has happened in this region is a model for the world, and I want to emphasize this because it only happens with political will and determination that we get to a point that we're at today. It represents years of efforts by healthcare providers and communities of people living with HIV, working together to ensure health systems have strong maternal, neonatal, and child health programs. It also requires the integration of HIV and syphilis interventions into MCH services and support for quality laboratory and data systems. And it also requires the protection of human rights, gender equality, and community participation. All of this we have heard about already this morning. And these are the key ingredients that remain essential to our ability to end AIDS as a public health threat globally by 2030. From the perspective of UNAIDS, what is particularly exciting about this process is that the MTCT certification is the first time in history that human rights, gender equality, and meaningful community engagement are formal factors in evaluating whether a country should receive certification for health achievement. And I hope it's not going to be the only one, but it is the first time that we have done that. At UNAIDS, we are clear that successful HIV programming requires the elimination of inequalities so that gender parity and human rights may be realized. Our current global AIDS strategy is centered on the need to end inequalities that drive and that perpetuate AIDS and any pandemic. So while we celebrate this tremendous milestone, we must also remember that in the Caribbean, we still have about 100,000 people living with HIV who are not on treatment yet. We need to ensure that each one of them has access to antiretroviral treatment. And we must remain vigilant on the prevention front. We know that criminal laws undermine health efforts. Where key populations and people living with HIV are criminalized, HIV incidence and prevalence are higher. We need to make sure that each child born HIV negative remains HIV free as they become an adolescent and later as they become an adult. We do this by providing SRHR, STI, HIV and other prevention services, repealing discriminatory laws and advancing gender equality. This is an issue of sustainability. The MTCT of HIV is a gain to be sustained throughout the life of every negative child. As I join PAHO and other UN agencies and partners in celebrating the bold leadership of Belize, of Jamaica and St. Vincent and the Grenadines, I'm reminded of the words of Dr. Martin Luther King. Power properly understood is nothing but the ability to achieve purpose. It is the strength required to bring about social, political, and economic change. There is indeed real power in committing to a purpose, in working with communities with respect for the human rights of all persons. Each time a new country is validated as having eliminated the transmission of HIV from mothers to their children, we save lives and we move closer to our penultimate goal of ending the epidemic by 2030. A goal that, when achieved, leaves a safer, healthier world in which all children can flourish. Thank you and congratulations again.
Thank you very much, Mrs. Stegling, and thank you to UNAIDS for their support and partnership. I think we have some more first-timers, right, coming up. We're going to have remarks now from Dr. Rhonda Seeley. She's the Assistant Director for PAHO. Please make her welcome.
Allow me to adopt the protocol that would have already been established, but I would also like to recognize Honorable Christopher Tufton, Minister of Health and Wellness of Jamaica, the Honorable Kevin Bernard, Minister of Health and Wellness of Belize, Mrs. Aretha Scott Douglas, Representative of the Ministry of Health of St. Vincent and the Grenadines, also Christine Stegling, Deputy Executive Director, Policy, Advocacy and Knowledge, Branch UNAIDS, Olga Izaza, UNICEF representative of Jamaica, other representatives from UN agencies, of course, Dr. Barbosa, my director of the Pan American Health Organization, Ian Stein, and the PAHO colleagues. Ladies and gentlemen, good morning. I'm extremely pleased to be with you today to celebrate the 4th elimination of mother-to-child transmission of HIV and syphilis certification ceremony in the Caribbean. Today, we recognize the remarkable achievements of Belize, Jamaica, and St. Vincent and the Grenadines that have been certified by WHO as having eliminated the mother-to-child transmission of HIV and syphilis. Let me take this opportunity to remind each of you that the seeds for the dual elimination of the mother-to-child transmission of HIV and syphilis were planted in the Caribbean approximately 16 years ago through the unified vision and commitment of the chief medical officers who assumed the leadership of the initiative. The CMOs of our region not only planted the seeds, they also worked tirelessly with their teams in building the components of the healthcare system needed for elimination. The result of this hard work is illustrated in the fact that over 50% of all the countries validated globally by WHO for EMTCT are from the Caribbean. This is an extraordinary achievement, which has as its foundation the previous disease elimination experiences in vaccine-preventable diseases in the Caribbean. It is my hope that these accomplishments are stepping stones for the elimination of even more diseases, such as cervical cancer, that are part of PAHO's Disease Elimination Initiative. We must take note of the fact that Belize, Jamaica, and St. Vincent and the Grenadines received certification for EMTCT during the COVID-19 pandemic, one of the most devastating crises the world has experienced in recent times, with extensive social, economic, and health impacts. Therefore, I wish to highly commend the governments of these three countries for their political commitment and dedication in ensuring that essential maternal and child health services remained one of the priority services during the pandemic. I especially acknowledge the healthcare workers from these countries who were at the forefront of the pandemic. Without them, we would not have been celebrating today. This ceremony is testament to their devotion, hard work, and commitment as they went above and beyond the call of duty to ensure that pregnant women, including those who were seropositive for HIV and syphilis, the exposed infants, and their partners received the care they needed, leaving no one behind. As we celebrate today, we must not forget other persons who have worked in the Caribbean on EMTCT elimination. While the list is extensive, I want to take this opportunity to remember the late Dr. Perry Gomez, a former infectious disease specialist and Minister of Health of the Bahamas, who was a dedicated advocate and trailblazer for the elimination of mother-to-child transmission efforts in the Caribbean, sharing his expertise and the experiences of the Bahamas with other Caribbean countries. Without his hard work, we would not be here today. While this celebration is certainly exciting, the hard work of sustaining and maintaining the gains have just begun. Indeed, the EMTCT for HIV and syphilis validation is not a one-time event. Revalidation is necessary every 4 years to demonstrate that the global targets are continuously met. For this reason, surveillance must be strengthened to ensure that cases are detected and monitored in real time, and any gaps and challenges in the healthcare system must be filled. As the former chair of the Regional Validation Committee for the Americas, and now as the Assistant Director of PAHO, I want to express my profound appreciation and gratitude to the members of the Regional Validation Committee for the Americas and teams that worked tirelessly in support of the revision of the numerous national country targets, EMTCT reports, analyzed data, and who conducted validation assessments of the countries being recognized here today. Before the ceremony, I was asked how I feel on a personal level for this. As a former chief medical officer of a country that was validated, I know the process. As the chair of the Regional Validation Committee, I know the process from that level. And now as Assistant Director, I oversee the Communicable Disease Department, so I'm also seeing it at this level. So I feel a sense of pride, I feel a sense of joy, I feel a sense of commitment, but I also know that the work continues. As part of PAHO's elimination initiative, we have to look to eliminate more diseases to get more countries and regions certified for the elimination of the mother-to-child transmission of HIV and syphilis. But we also need to work towards cervical cancer elimination, which is a passion. As I close, I want to remind you that elimination, it's really good, and I congratulate all the governments and the teams, but it's more than a validation ceremony, it's more than a validation certificate. It's what we see here It's the lives we save, the mother, the child, and the love and caring that we actually see. And we have to remember that we actually are touching lives as we validate countries. I want to pledge PAHO's ongoing technical support to our member states as they continue to work diligently to end HIV, sexually transmitted infections, viral hepatitis, and other communicable diseases by 2030, so that future generations can enjoy health, impactful lives free of these diseases. Congratulations to all countries, and thank you for your kind attention.
Thank you very much, Dr. Seeley. And at this time, we'll welcome with special remarks the Director of the Pan American Health Organization and our special guest in Jamaica, Dr. Harbas Barbosa. Please make him welcome.
Good morning. Please allow me to name some people that are here, because I think that behind them we have a very strong teamwork and a very strong political commitment and a very important technical work to get us today here to celebrate this very important achievement. So I want to first thank the Honorable Christopher Tufton, Minister of Health and Wellness of Jamaica, Honorable Kevin Bernard, Minister of Health and Wellness of Belize. Minister Bernard, what will happen next year? Because last year you received the malaria elimination certificate, so this year, this new certificate, so next year probably you have something prepared to show us that Belize is at the forefront of the elimination. Mrs. Arlita Scott Douglas, representative of the Ministry of Health of St. Vincent and Grenadines. Christine Stegling, Deputy Executive Director, Policy Advocacy and Knowledge Branch, UNAIDS, and our very close partner on this important initiative. Olga Isaza, UNICEF representative for Jamaica, also another very important UN agency that work together with us. Valerie Wilson, representative of the regional and global validation committees, that I think that is proud for us to have two. I learned this morning that we have two representatives for the region that are part of the global validation committee. Mr. Ian Stein, representative of the PAHO WHO country office in Jamaica, and on his behalf, I want to thank our colleagues here in Jamaica, in Belize, and the multi-country office in Barbados, and the St. Vincent and Grenadines that have been working together, supporting the ministries of health of these countries to have this achievement. Dr. Rhonda Seeley Thomas, our Assistant Director, and also former Chair of the Validation Committee. Dr. Monica Alonso, Unity Chief, that you also think that represents a very important group of people that work from Washington and with our colleagues in each one of the country offices in this region to advance the public health agenda, and in this case, the elimination of diseases. Representatives of United Nations agencies and the diplomatic community, representatives of civil society organizations. I think that it was very important to hear and to watch you in this video. And we know that for diseases like HIV and AIDS, if you don't, and many others, hepatitis and many other diseases, TB, if you don't have the very active participation of the civil society, we cannot sometimes identify the barriers and what are the strategies that we need to adopt to remove these barriers and to guarantee their access to the technologies that are already available. Members of the media, distinguished guests, esteemed ladies and gentlemen, good morning. Today marks a momentous occasion as we gather to celebrate the validation of the elimination of mother-to-child transmission of HIV and syphilis in Belize, in Jamaica, and the St. Vincent and Grenadines. This achievement is a testament to years of dedication, hard work, and collaboration among governments, health professionals, and communities. I extend my heartfelt congratulations to everyone involved in this remarkable journey. Your unwavering commitment, combined with the strong leadership of the health authorities and political commitment at the highest levels, has brought us to this pivotal moment where we can celebrate the impact of your collective efforts on improving the health of children, mothers, families, and communities. I must also underscore the dedication of the health workforce, especially those on the front line during the pandemic. Your perseverance and sacrifice have been instrumental in achieving and maintaining this milestone. The challenges posed by the COVID-19 pandemic were considerable, disrupting healthcare systems and services worldwide. Despite these challenges, the countries we celebrate today demonstrated remarkable resilience. They maintained their focus on EMTCT and ensured that essential services were successfully adapted and continued with a swift recovery and without compromising previous achievements. By promoting evidence-based practices and quality standards for primary health care and maternal and child health services, Belize, Jamaica, and St. Vincent and the Grenadines join a total of 11 Caribbean countries and territories validated for EMTCT in the region of the Americas. As been mentioned, the commitment of chief medical officers and the steadfast leadership in the Caribbean have played a crucial role in advocating and promoting EMTCT in the region. Let me also acknowledge the strong leadership of Dr. Rhonda Philly-Thomas in her former role as CMO of Antigua and Barbuda, one of the countries validated for EMTCT of HIV and syphilis, and as former chair of the Regional Validation Committee, where she guided the PAHO and countries during assessments for validation. In her new capacity as Assistant Director of PAHO, I am confident that Dr. Philly-Thomas will continue to drive progress and further advance EMTCT achievements in the Caribbean and in Latin America. Let me emphasize that this accomplishment is not the end of the road. Continuous efforts are needed to sustain the EMTCT of HIV and syphilis. While we celebrate these milestones, we must also address the rising cases of syphilis and congenital syphilis in the region of the Americas. HIV mortality has decreased across the region, yet the number of new HIV infections has not been reduced as expected at the expected pace. Comprehensive and integrated approaches and investments in HIV and sexually transmitted infections responses are needed to reverse this concerning trend and to achieve our goals. We must ensure that all mothers and children, regardless of their background or circumstances, have access to essential healthcare services. Empowering communities to participate in decision-making processes and program designs results in health interventions that are accepted, sustainable, and impactful. Furthermore, the validation of EMTCT of HIV and syphilis represents a stepping stone towards the elimination of other communicable diseases. I encourage countries to leverage these EMTCT achievements and experience to tackle other diseases, including the more than 30 communicable diseases and related conditions for which elimination is possible and achievable through integrated actions as envisioned by the Elimination Initiative, a flagship program of the Pan American Health Organization that was approved by our member states in 2019, suspended, unfortunately, during the period of the pandemic, when we tried to concentrate our efforts to support our member states, but we also relaunched the last year, and these are one of the priorities of my administration. Before closing, I extend my congratulations and gratitude to all the regional partners that contribute to this process. Specifically, I would like to thank UNICEF, represented here by Olga Izasa, for co-chairing the EMTCT Secretariat with PAHO, UNAIDS, represented here by Christine Stegling, for the continued support and advocacy in the region, and the chairs and members of the Regional Validation Committee for their guidance and support. In conclusion, I hope that the celebration today will inspire other countries in the Caribbean and across the region of the Americas to reinvigorate their commitments to EMTCT and close the gaps towards the achievement and elimination goals. I want to congratulate again the three ministries of health, the ministers that are here, the representative of the Ministry of St. Vincent and Grenadines. Minister Tufton is a very strong leader in the region. always advocating for health promotion, how we can improve the response to non-communicable diseases and other very important public health matters. Minister Bernard is also a very strong leader in our region, has already recognized his leadership in achieving malaria elimination last year, and San Vito and the Grenadines also is showing today the commitment of a small island development state that can really promote health for their population. Let us continue our efforts with renewed determination, knowing that the work that is done at the local level, in rural and remote areas, in slums, and the work with indigenous communities and other vulnerable populations have a profound impact on the health and well-being of generations to come. Thank you to everyone who has contributed to this journey.
Thank you very much, Dr. Barbosa. And of course, we want to seal the deal. We're going to present now the certificates to the recipients, and these certificates are from the World Health Organization. So I invite Dr. Seeley to join me on stage, as well as Minister Tufton, Minister Bernard, and Mrs. John Douglas from St. Vincent and the Grenadines. You can be seated. When they clap them as they come, clap, 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 clap. Please. All right, you can be seated. The first presentation is to Belize, and we're gonna watch a short video that will tell us the story of Belize. You can be seated. So let us tune to the monitors to see the story of Belize's journey.
The process that we went through for validation was very thorough. It shows that the validation was not only achieving the certification, but rather an opportunity to strengthen the health system, to sustain the elimination of mother-to-child transmission, and most importantly, that the elimination and achieving certification is the right of every child to born and remain free of HIV and syphilis.
We had started with the program of elimination from about the year 2000, between 2000 and 2004, when it really strengthened. We have been able to strengthen the capacity in our laboratory services. That has also helped us for early detection, more awareness, and early treatment, of course.
As soon as a woman goes to the general clinic, a pregnancy test is done, and she's automatically booked into the prenatal clinic, so that we get them as early as possible in the first trimester. And that has been another change that we have seen, where the amount of pregnant ladies joining the clinic in the first trimester has increased to about 90%. The medication used requires no out-of-pocket payment by patients. That is also a very critical part of ensuring that we continue to provide these medications free of cost.
So Stephanie came in today, and we did first a group talk with the other pregnant women that came in, and the health education that includes HIV, all the lab tests, including the HIV. And we also go more in detail with the HIV and syphilis testing that they will be getting today, and why it is important for them to get it.
It's important for me to have the syphilis and HIV tests because I don't know if I have it. So if I would know that I have it, then I would make sure that the baby is okay, because then it can be transmitted to the baby, and any complications can cause complications to the baby, and that's what I want to avoid.
They feel free to come into the clinic, especially those who already know their status. We give her a lot of support. They come to the clinic, they have a seat, they go through the process just like any regular client.
One of the lessons learned is that this can only be achieved, the elimination of mother-to-child transmission of HIV and syphilis can only be achieved when there is strong teamwork and quality healthcare services being provided.
The science says it's possible. It's the healthcare worker and the family that needs to make it happen. And so we are proud that we made it happen. And we are proud and committed to continue the efforts.
Well, in my opinion, it's very, very important that we eliminate the mother-to-child transmission so that that neonate, that baby can grow up living a healthy life.
And most importantly, every child has the right to born and remain free from HIV and syphilis.
Yeah, achieving the elimination feels very good. It's proud as a country. I would like to express, overjoyed. We feel really privileged to have worked so hard and being recognized.
It's an awesome feeling. We've worked hard at this, years of hard work and dedication.
I was overwhelmed with joy and happiness, and mostly because it means that we really help these families to have at the end, a child that is free of HIV and syphilis.
It is also a big achievement for the country because it shows how with a team effort, with the partnership between the Ministry of Health and PAHO, that we can achieve these elimination goals. And so nothing is impossible.
Congratulations again to Belize. And I invite Doctors Barbosa and Seeley to make the presentation to the Honorable Kevin Bernard, the Minister of Health and Wellness for Belize. Got it. Okay. Good. All right. Congratulations again. We'll now go to St. Vincent and the Grenadines, and let's tune to the monitors to see their story.
So we have a very strong primary healthcare system, which is managed by our nurses and our physicians. We also strengthen the lab. We also strengthen our data collection.
All of our health centers offer antenatal services. So persons have access to the health centers. And once you go to a health center, we offer the service. And part of the packages is that you are supposed to have your HIV test done, your syphilis test done.
Before we implement the mother-to-child transmission was really in terms of encouraging patients, the need, and therefore the educational part of it, in letting them understand why it is important for us to do these tests and why should we repeat it.
Before implementation of the strategy, what we were seeing here in clinic is that patients, pregnant women, were coming very late in pregnancy for treatment, as in the antiretrovirals during pregnancy. So I can clearly say that we have seen a drop in the numbers of babies being born or being exposed to HIV because of the implementation of this strategy.
When we look at in terms of HIV testing, we've had a lot of training from our regional partners, PAHO and the Caribbean Medlabs Foundation. What is really critical and what really contributed to this sort of success was the fact that we moved away from sending our samples abroad. Having that instrument have now enabled us to do a lot of testing in country quicker and to have more testing done with less cost to the patient and less cost to the government. So,
for us, it was not just one-on-one,
in terms of sharing the information, building the capacity individually and collectively, but also the psychosocial services that were provided.
Well, I think the biggest achievement is really to get people to understand the importance of the issue.
The guidelines, the biggest thing with the guideline is that it helped to get everybody on board so that we're all following the same policies and the same protocol, so that we know that if a patient comes to me and this patient goes somewhere else, it is saying the same thing.
For me, what is important is sustainability, not just as a Ministry of Health, but as a country to ensure that we continue to provide this very vital and appropriate services to the people of St. Vincent and the Grenadines.
We just have to continue, keep focusing. We need to be more vigilant when it comes to surveillance and reach persons where they are, so we can continue and fight towards being a better country, being a more healthy nation.
I must say kudos to the persons who have worked over the years on HIV.
I think the team in health is phenomenal. And I think that if we step back a bit and look at what we have been able to achieve, we would appreciate the strength we have. All of these accomplishments were done as teams. We were able to work together. Congrats to St. Vincent and Grenadines, the primary health care, the public health system.
Congratulations to St. Vincent and the Grenadines. I invite again Dr. Barbosa and Dr. Seeley to make the presentation to Mrs. Alethea John Douglas. She is the MTCT focal point at the Ministry of Health in St. Vincent. All right. Now we move to the host country, Jamaica. Yeah, right? Let's hear the story of Jamaica.
To think that we can stop the transmission of HIV from a mother to a child, and to think now we've reached a point that HIV positive ladies can have children, it's a tremendous goal that we have achieved, and I really do hope that we continue to keep this up. I know that we will.
So MTCT has always been on the forefront of our program because it's one of the ways that we as a country could verify that we had epidemic control of HIV, and also that we are managing syphilis to prevent congenital syphilis in our babies. So ever since the early 2000s, we have had a PMTCT program, a prevention of mother-to-child transmission of both HIV and syphilis. And by the end of 2002, PMTCT was ingrained in our health system.
Jamaica has been working on this for a long while, and we are seeing the fruits. The women, I think, just us being able to support them through this process to have HIV-free babies and syphilis-free babies is a major win for us as a healthcare system and a country.
As a Jamaican, it really gives me joy just that we're able to accomplish this. You know, it's a small island and we don't always necessarily have all the required tools and all the prerequisites, but just with our team that we have here, National Public Health Lab, our quality management system, and every member here, regardless of what role they play, it was really just a good thing seeing us going through the various steps and accomplishing this. You know, we just really try to live up to our motto, out of many one people, so it's really a team effort. It's not just one.
So I know for those of us on the ground, the residents, pediatricians, the nurses, midwives, porters, janitors, I mean, it's a lot of hard work that we've had to undergo. So, I mean, for us, it's great. For Jamaica, it's a step in the right direction. You know, our goal as a healthcare in Jamaica is really just to be the best for our patients. And I think this is definitely a step in the right direction.
It has been a journey. Our team has been compassionate. They have been sensitive to the patients and their needs and their confidentiality. So no one no longer needs to feel ashamed or feel afraid of coming to seek that level of care, because we are here to care and to ensure that you have the best outcome.
Personally, I think as Jamaicans, we really work together. We unite together the different entities. What we do is to get other women involved and partners involved, and also to get the individual, the participants involved as much as possible. So it's not like just giving, but they are giving, receiving,
Yes.
Collaboration, yes.
I felt very proud for Jamaica to achieve the status of elimination of mother-to-child transmission. I'm in the program for many, many years and see the hard work by the team. The team is so motivated that you do not have to do anything. They know what they need to do, and I can tell you, Team Jamaica.
So what is the next step? I mean, we have to maintain what has been done, and we have to look and see within the international sphere if there's anything else that we need to address in terms of preventing mother-to-child transmission of diseases, because at the end of the day, we do want a healthy society.
So I really want to use this opportunity to say a very big thank you on behalf of the government and people of Jamaica to PAHO WHO for the leadership and the collaboration, to our various stakeholders, including civil society groups, because it is through that joint effort that we're able to celebrate this a major achievement today. I think it's a big win for Jamaicans and by extension for the people of the Americas.
All right, let's hear it for Jamaica. So invite Dr. Barbosa and Dr. Seeley to make the presentation to our Minister of Health and Wellness, Dr. the Honorable Christopher Tufton. All right, congratulations again to all the countries. I'm going to ask them to remain. We'll do a group photo in a minute. Yes, stay, you can sit. No, you can sit. Yeah. He follows my instructions, right? We actually have acceptance remarks, so we're going to hear from the Honorable Kevin Bernard to give his remarks of acceptance at this time. He's the Minister of Health from Belize.
Thank you very much. I know protocol have been established, but I want to, of course, acknowledge my colleague, the Honorable Dr. Tufton, the Minister of Health and Wellness of Jamaica, the representative of the Ministry of St. Vincent and the Grenadines, Director of PAHO, Dr. Barbosa, Deputy Director, Assistant Director, Dr. Thomas, our friends that are here from PAHO and UN agencies, and of course, the lovely Jamaicans. Thank you for hosting us. Before I start, though, I would like to also extend my appreciation to Nurse DeVille, Dr. Bear, and my team in Belize who are watching us live from Belize, and our PAHO team in Belize who have been very supportive to this initiative. It is with a heartfelt of pride and joy that I stand before you here today as we celebrate an achievement that once seemed like a distant dream. Today, Belize joined the ranks of countries, together with Jamaica and St. Vincent and the Grenadines and the 8 other countries in the Americas and the 17 countries now in the regions, that in receiving the official certification for the elimination of mother-to-child transmission of HIV and syphilis, a milestone for our country and a beacon of hope for our future generations. This accomplishment is not the work of a single individual, but the result of years of unwavering commitment and relentless effort from our healthcare workers. From the nurses in rural clinics to the specialists in our hospitals, from community health workers to laboratory technicians, it is their dedication that has brought us to this momentous day. Since the inception of the MTCT program in 2004 in Belize, we have faced numerous challenges, but with each challenge, we found new strength and innovative solutions. Our collaborations with the Pan American Health Organization has been instrumental in this journey. PAHO's support has helped us to break down barriers to care and has provided invaluable guidance, for which we are deeply grateful. So, Dr. Barbosa, to you and your team at PAHO, I once again extend on behalf of our people, our country, and our government, our deepest appreciation to the organization. The elimination of mother-to-child transmission of HIV and syphilis is more than a medical victory. It is a promise to our children for a healthier start in life. It is a testament to our belief in healthcare as a right for all and our commitment to the public health as a cornerstone for a more vibrant and productive Belize. As we receive this certification, let us recognize that our work does not stop here. We must continue to strive for excellence in healthcare to ensure that every Belizean and every resident in our countries in the region, regardless of where they live or their economic status, has access to high-quality health services that they deserve. In closing, I want to take on the challenge of Dr. Barbosa's earlier remarks when he stated that I was here last year for the elimination of malaria. We're here for the elimination of mother-to-child transmission, and hopefully, Dr. Barbosa will be here to celebrate the passage of the tobacco control bill that Belize has finally received its final draft just last week. And so, I want to pledge to you all that the Ministry of Health and Wellness in Belize will continue to work tirelessly towards the betterment of public health in Belize. And together, we will build on this success and continue to make strides in the pursuit of our healthier region with stronger visions for stronger nations. Thank you very much.
Thank you, Minister Bernard. And now I invite Mrs. Aretha John Douglas, the AMTCT focal point in St. Vincent and the Grenadines, to make her acceptance.
Good morning, everyone. Permit me to adopt the protocol. The Ministry of Health, Wellness and the Environment, and by extension, the government and people of St. Vincent and the Grenadines would like to begin by extending our warm thank you to World Health Organization and Pan American Health Organization for this recognition and award for the elimination of mother-to-child transmission of HIV and syphilis. I also take this opportunity to express gratitude to our healthcare workers, both private and public, who have worked collectively to help us to get to this point. This award today is yours. I also bring greetings from my Honorable Minister, Sinclair Prince, who is unable to be here today. However, as a country, we cannot emphasize how important this is to us. Not only is it a testament of our resilience as healthcare workers, but a big win for our strong maternal and child health programs that integrated HIV and syphilis intervention in maternal and child health service and child health care. This certification is something that we will cherish and commit to maintaining for years to come. The certification came at a time when we, as a country, were faced with 4 whammies, as we put it. We were battling dengue fever, COVID-19, volcanic eruption, and compounded with that, we had Hurricane Elsa, which caused flooding. Compounded with this situation also is the fact that our country is multi-island state of 32 islands and keys. The process of certification of the elimination of mother-to-child transmission of HIV and syphilis started in 2016. We had to stop. And then we restarted in 2019. During this period, one of our clinics experienced a fire, destroyed relevant information related to the elimination process. Our health system was and continues to be plummeted by the migration of healthcare staff, and many clients were displaced from their original clinics to volcanic eruption shelters. This saw many healthcare workers being rapidly mobilized to work in shelters and other clinics. However, our healthcare professionals were able to battle these elements and provided optimal healthcare services to our citizens, inclusive of antenatal, intranatal, and postnatal care. And for this, as a country, we are forever grateful. This certification which we have received signifies, and I must say, emphasize the word, it signifies the importance of us having an accessible, affordable, and available healthcare system, allowing the vulnerable to access the care needed. This is more than just an award for us. It's a given to acknowledge and maintain the prevention of HIV and syphilis transmission. We recognize that as a country, this is just the beginning, and there is a greater need for us to sustain and maintain this certification. We will continue to strengthen our healthcare system, our protocols and initiative as we move on to other certification, such as the elimination of hepatitis B, cervical cancer, and leprosy. I would like to take the opportunity to thank St. Vincent and the Grenadines elimination of mother-to-child transmission of HIV team. We had a team who worked tirelessly to make this a reality. We extend our heartfelt thanks also to the private sectors, the doctors, our nurses, our lab technicians, the citizens of St. Vincent and the Grenadines, without whom this would not have been achieved. Once again, the Ministry of Health, Wellness, and the Environment, St. Vincent and the Grenadines would like to say thank you for awarding us this prestigious certification. We appreciate it. Thank you.
Thank you very much, and a big congratulations again to all our countries. Of course, Dr. Tufton is our keynote speaker, so he will speak at that time. So now we'll do our group photo. So I invite all our awardees. Where are the happy faces? They're not looking happy. They're looking happy? This is going global, right? So we have to give the moment, give the time. We have to allow the time. All right, congratulations again. A big hand to Belize, to St. Vincent, and the Grenadines, and Jamaica for receiving these certificates. So we're going to have a special message from the Director General of the World Health Organization. I invite you to tune to the monitors as we hear a message from Dr. Tedros Ghebreyesus, our Director General of the WHO.
Honorable Ministers of Health, my colleague Dr. Jarbas Barbosa, dear colleagues and friends, I congratulate Belize, Jamaica, and St. Vincent and the Grenadines on achieving the elimination of mother-to-child transmission of HIV and syphilis. Since 2010, the global community has made ending maternal transmission of this deadly disease a public health priority. The region of the Americas has been at the forefront of realizing this commitment. Cuba was the first country to be validated in 2015. With the addition of Belize, Jamaica, and St. Vincent and the Grenadines, 19 countries have now achieved the elimination of vertical transmission of HIV and or syphilis, including 11 in the Americas. I commend Belize for integrating primary disease prevention and treatment within maternal and child health services. I commend Jamaica for the commitment of its civil society organizations to fostering respect for human rights. And I commend St. Vincent and the Grenadines for investing in strong national laboratory structures. While validation is a tremendous accomplishment, maintaining it requires sustained efforts to prevent new infections. WHO and partners will continue to support all countries in the Americas to strengthen health systems, to provide comprehensive services, and to ensure the involvement of women in planning and service delivery. Congratulations to you all once again, and thank you for your commitment to a healthier, safer, fairer world. I thank you.
Thank you very much. At this time, our Minister of Health and Wellness, Jamaica, Dr. the Honorable Christopher Tufton, will deliver the keynote address. And of course, he's our fearless leader. He's dedicated, passionate, goal-oriented, and we thank him for his hard work throughout the years. Please make him welcome.
Thank you very much, Stephen Davidson, who is head of our communications unit at the Ministry of Health and Wellness, and now qualified to be a full-time MC. Okay, so many distinguished ladies and gentlemen in the audience, and today is such an amazing day. So many presentations have been given. I would not consider myself the main speaker, but I really want to take the opportunity to welcome every single person in this room, and in particular, our visiting friends. And I hope that this momentous occasion is one that will see the celebration here, but also find some time to relax. Ian Stein, who is the PAHO country rep, tells me that every audience I speak to with visiting friends, I tell them, I won't judge you if you spend some of your money as part of our tourism receipts. And I won't give you any warning if you have one or even maybe two Red Stripe beer. How is that? Okay, so let me begin by recognizing all the distinguished persons here. Special guests, Christine Stegling, Deputy Executive Director, Policy Advocacy Knowledge Director, UNAIDS, and Assistant Secretary General of the United Nations. Welcome to you. First time here. I hope this will not be your last. Dr. Jabars Barbosa, Director of PAHO, my friend and our colleague in the Americas. Dr. Rhoda Seeley, Assistant Deputy Director of PAHO, who is our Caribbean national, who we are very proud of. Good to see you again. The Honorable Kevin Bernard, Minister of Health, Belize, and also my good friend. Welcome, sir. My permanent secretary, who may not be here because I believe he's on assignment representing me somewhere else, but he may catch us at the tail end. I want to recognize him for his leadership. And Dr. Karen Webster Carr, who is our chief epidemiologist, but today wears two caps as representing the chief medical officer, Dr. Bisesa Mackenzie, who I believe is on a mission representing PAHO also. I think so, or WHO. Well, one and the same, WHO, right? In a faraway place, Cambodia. And she sends her best wishes and well regards. Members of the Diplomatic Corps, so many of you here, too many to mention. Monica Alonso, Chief HIV/AIDS Unit, PAHO. I recognize Mr. Ian Stein already. He's no stranger to us. Good to have you again, sir, as usual. Dr. Izazo De Francisco, Representative UNICEF, Jamaica Country Office. I keep bastardizing your name. I'm sorry about that again. Dr. Richards, UNAIDS Country Director. And I want to recognize also our UN Resident Coordinator, Dennis Zulu, who is here with us. Directors of the Ministry of Health and Wellness, I see you here, civil society partners, distinguished guests, members of the media, one and all. It's a good day, right? And we thank you for being here, and we give thanks for this day. Today is tremendous for us. It's a success, not just for Jamaica, but certainly for the Caribbean. And I really want to express on behalf of the Jamaican government, the Jamaican people, our sincere appreciation to the efforts that have led us to this point. It is a momentous occasion, and it's an important victory in the fight against HIV as a public health challenge, not just in Jamaica, but certainly in the region. So Jamaica, Belize, and St. Vincent and the Grenadines joins 8 other Caribbean countries that have been certified, as you know, by the World Health Organization as having eliminated mother-to-child transmission of HIV and syphilis. There is much significance to this. HIV has for more than 40 years remained a challenging global public health threat. Moreover, the Caribbean is documented as having the second highest incident rate of reported AIDS cases in the world, and with an estimated 330,000 Caribbean people living with HIV/AIDS. Amidst the difficulties, however, this ceremony is evidence that progress is being made to end the ravaging impact of this viral disease. Jamaica's success on elimination of mother-to-child transmission of HIV and syphilis signals an enduring commitment to the Sustainable Development Goals of ensuring healthy lives and promoting well-being for all people at all ages. This achievement has been the outcome of concerted and coordinated national action with a multiplicity of interventions to close the HIV prevention and treatment gap for children, adolescent women, and expectant mothers. And that is a major achievement. Those efforts have included steady scaled up in the delivery of care, especially across maternal and child health services, with improved access to rapid testing, diagnosis, and treatment, improved monitoring and evaluation, linkage to care and follow-up, medical, social, psychosocial, and peer support, and implementation of preventable guidelines. Undoubtedly, maternal and child health, including safeguarding the health of infants born to HIV-positive mothers, is among the chief priorities for the healthcare system. The wide availability of antiviral to stop HIV-positive women from infecting their unborn child or infant is among the critical components that undergird efforts towards eliminating mother-to-child transmission. True to our commitment to protect the health of all, Jamaica's public health system is moving increasingly towards higher service delivery, and those affected by HIV will not be left behind. Among the important provisions have been access to antenatal care, the increase in HIV testing and counseling among pregnant women through the expansion of healthcare provider initiative approaches, and continued care management of syphilis-exposed infants. The management of syphilis in pregnancy has continued to improve with access to diagnosis and appropriate treatment to syphilis-positive mothers. Of significant note is the financial investment of some Jamaican $27 million for HIV and syphilis screening of all pregnant women. This elimination of mother-to-child transmission of HIV and syphilis is a win that underscores protecting the health of all. It also exemplary of the extraordinary progress being made in our maternal health care. What's more, it is vitally important that we consolidate the gains made from this achievement, especially through continued community engagement and partnership for the public health interests of all. There is no room for complacency. As the public health system heightens its progress in client-centered care, HIV prevention, care, and treatment must and will remain a priority. Work is still to be done. There is need for increasing linkage and retention to care, testing, counseling, retention in care, adherence to HIV treatment and viral suppression. Early uptake of and regular safe maternity services remain critical, including antenatal care, delivery care, including emergency, obstetric, and newborn care, postnatal care, and postpartum family planning. This is an area for much keener attention in our population, and one that we here in Jamaica are placing great priority on. Importantly, I'd like to take the opportunity to call on other countries in the region to scale up efforts to combat the threat of HIV/AIDS, especially through mother-to-child transmission. And for us who have been able to achieve this important milestone, we stand ready as a team, as partners, to work with you and to provide whatever support we can, of course, with our other bilateral and multilateral partners. When we elevate the health status of the most vulnerable, when we elevate the status of the most vulnerable, we advance the health of the entire nation, and indeed, I dare say, the region and the Americas. Much work is needed to stem the spread of infections across the Caribbean. Greater unity must be fostered for the region to forge ahead towards achieving universal access to HIV prevention, treatment, and care. Today's validation achievement is a result of partnership. It's a concept, it's a term, it's a practical approach that we preach here in Jamaica, that health is everybody's business, from the individual perspective, to the family perspective, to the community perspective, of course, to the country, to the region, and indeed to the world. And if there's any lesson learned from the COVID experience, it is that we rise or we fall together, and hence that partnership is absolutely critical. I want to extend heartfelt thanks to the ministry's HIV, STI, TB unit and the teams across the regional health authorities for their unwavering commitment to the national HIV response. It really is a team effort within the ministry as well as with our stakeholders externally. To our international partners who are well represented here today and remain active to accelerating movement toward HIV epidemic control, we say a big thank you. Through reinforcement of this solid support, we anticipate further improvements of the access to quality services as we continue working to achieve viral suppression of HIV/AIDS. I also wish to acknowledge the ardent involvement of civil society groups and other stakeholders as an important part of this collective work. Community support is crucial to our efforts. With that said, and in keeping with the mission that we are on, I express gratitude on behalf of the Ministry of Health and Wellness to our health team and partner organizations for moving Jamaica forward in the fight against HIV/AIDS. To the Ministry of Health in the region, including my colleague minister here, let us further drive commitment in the delivery of HIV quality and people-centered services for all, including those impacted by this deadly virus. Ladies and gentlemen, again, a historic event, occasion, one worth celebrating, and I say thank you again for all who have played their part. Let us continue towards a healthy and a wellness world and region. Thank you.
Thank you very much, Minister. And of course, no PAHO WHO Jamaica celebration is complete without ASHE. So we're going to be entertained now by ASHE. They are a social enterprise organization that survives and thrives on a delicate balance between theater, performance, and social work. Please make them welcome. And they're really taking over, right? Another hand for ASHE.
In September 2010, the Pan American Health Organization unanimously approved a strategy and plan of action for the elimination of mother-to-child transmission for HIV and congenital syphilis in our region. Between 2023 and 2024, Belize, Jamaica, St. Vincent and the Grenadines attained WHO certification for eliminating mother-to-child transmission of HIV and syphilis.
Let's celebrate. It's gonna be a brighter day. Sun is shining, the weather is sweet. Sun is shining, sugar, sugar. Let's celebrate. It's gonna be a brighter day. Yeah. Sun is shining, the weather is sweet. Sugar, sugar. Make you wanna move, make you wanna move. Caribbean coming to the rescue. Rescue, here I am. Here I am. Want you to know now. Where I stand. No, where I stand. To the rescue. To the rescue. Here I am. Caribbean people, let us celebrate this achievement. Led the way to achieve our goal. We've eliminated transmission of HIV and syphilis from mother to child. Oh, Caribbean people, let us celebrate this achievement. Look how far we've come now in conscious determination. Striving for the best, whatever the test. Now we're even stronger than before. Now we're on a mission, a full elimination. Zero is our goal. Mother to child transmission. We have come so far now. Still there's more to go. Let's do more. HIV elimination. Of mother to child transmission. We have come so far. Let's do more. No, it wasn't easy. Our journey is unfolding, yes. Soon we'll have the victory. Your generation's free. We have come so far now. Still there's more to go. Let's do more. HIV elimination. Of mother to child transmission. We have come so far. Let's do more. Carry on from the bottom to the top. Always moving forward and we're not turning back. We're not gonna stop the progress if you know we're on top. EMTCT, I'll be back. We're gonna carry on from the bottom to the top. Always moving forward and we're not turning back. We're not gonna stop the progress if you know we're on top. EMTCT, I'll be back. We're city vision. In a new era. We help out with online work. Take the way, day to day, made our way. But it's time to make it. The city vision. In a new era. We help out with online work. Take the way, day to day, made our way. But it's time to make it. We have come so far now. Still there's more to go. Let's do more. HIV elimination. Of mother to child transmission. We have come so far. Let's do more. Celebrate. Dance now. Throw your hands in the air. Stand up. Dance now. Throw your hands in the air. Big up Jamaica, Belize, Vincent, Grenadines. One structure, one team, one MTCT. Head on the floor, it's creating opportunities for your child, mother, people, syphilis, and HIV. Big up Jamaica, Belize, Vincent, Grenadines. One structure, one team, one MTCT. Head on the floor, it's creating opportunities for your child, mother, syphilis, and HIV. Be where you are, creating the elimination, never the burden of the transmission, bounce and bury certification. Yeah, they're excited. Leave with it, rock with it. Elimination, never the burden of the transmission, bounce and bury certification. Yeah, they're excited. We have come so far now, so far. Still there's more to go. Let's do more. HIV elimination, of mother to child transition. We have come so far. Let's do more. Ashley.
We'll have to reassemble my stage. Come on, no. Oh, it's right there. Thank you. All right, one more time for Ashe. And of course, they come with the original. We're going to have now our closing remarks, and I invite Miss Valerie Wilson, the representative from the Regional MTCT Validation Committee for the Americas and the Global Advisory Validation Committee, to give those closing remarks. Please make her welcome.
Good morning. And as the final speaker, I do really adopt the protocol that has been established. Very much a pleasure for me to be here this morning and to represent the Regional Validation Committee. The chair was not able to attend, and it is my pleasure to be here as a fellow Caribbean person to celebrate. I feel like I should be doing some reggae and giving you a little rap here after that wonderful presentation. But ladies and gentlemen and distinguished guests, it really is a wonderful thing to be here to witness the achievement of the certification of validation for the countries of Belize, Jamaica, and St. Vincent and the Grenadines. It's truly a day for congratulations to the ministries of health of these three countries and to the Caribbean on having achieved the excellent milestone of having 11 countries, those who have actually achieved elimination, but also those who have managed to maintain their validation as the maintenance assessments have been conducted. This is really a notable achievement of which we are all justly proud. And it really emphasizes the fact that elimination is not a single target, it's an ongoing effort. And the improvements that need to be made at all levels are really important to maintaining that certification going forward. We are all aware, and Dr. Dion, Jody Dion, who is the chair of the Regional Validation Committee, who wasn't able to be here, has asked me to share a few words with you. We are all aware, really, of the ongoing concern about global transmission of HIV and syphilis. And we know how important it is to prevent these infections. So we really do recognize the excellent progress that we're making in terms of the science, in being able to use the tools that are available to us. And the honorable ministers really outlined very well the efforts that have gone into making this a real achievement and a reality within our region. We know that on this momentous occasion, we have and must convey our appreciation to the national health teams, all the public health officials, the doctors, the nurses, the lab personnel, the pharmacists and community health workers, the leadership of the Ministry of Health, and of course the community representatives and the persons who represent those who, whether they live with HIV or have had syphilis, or those who are trying to prevent it in our communities. We know that all of them deserve our sincere thanks for this momentous achievement. We know that in sustaining and supporting these programs, we must ensure that all pregnant women and their partners and their infants have access to high-quality care. And we know, as has been already outlined many times this morning, that care and coordination in the healthcare system is a complex, very complex process and relies on excellence and commitment at every level to reach this goal. I, in my real work, in my working life, I'm the director of the Caribbean Med Labs Foundation. And we have worked with many labs and laboratory systems within the region to improve the access and quality of services, not only for HIV and syphilis, but for other aspects of laboratory services and testing services within the region. So it is with a sense of personal pride, as well as a sense of the pride of the Regional Validation Committee that we recognize the excellence shown by these individuals and teams in Belize, Jamaica, and St. Vincent and the Grenadines. And as we highlight the way for other regions and countries to follow, we look forward to more countries being validated. As dedicated members of the RVC, we would like to really uphold and commend the efforts of all the countries that have been validated today, but also those who have been validated previously. And we give special thanks to the members of the Secretariat at PAHO that support the regional validation process and the Region Validation Committee in the hard work, and the teams in the hard work that they do. We really do thank our PAHO colleagues for their support. We congratulate all of you who have been involved in supporting this initiative, and all the persons online and elsewhere, maybe those who are not able to join us today, on the work that they've done to make sure that this has become an achievement of which we are all justly proud. And most importantly, we look forward to all the healthy children and their mothers and families who will benefit from this initiative in the future. Thank you.
Thank you very much, Ms. Wilson. And that concludes our celebration. Right? It doesn't really end, right? Just this portion of the ceremony ends. So I thank all our presenters, and congratulations to all our speakers, and of course our permanent secretary joined us, coming from another function. Welcome, sir, Mr. Dunstan Bryan, who is the head of the Ministry of Health and Wellness. So thank you again, and I invite, if the media needs interviews, we have a space that is available to conduct interviews, and you are all invited to tune into the sectoral presentation for the Minister of Health and Wellness at 2 p.m. You can watch it online, and of course we invite you back again for our reception in honor of Dr. Barbosa at 6 p.m. right here in the Montego Bay Suite. So have a good rest of evening. Good afternoon, right? Good afternoon. Morning still, we're early. Want to redo it? It's a hard, yeah?